talked about what we think will be our end game when we have the vaccine and then enough of us have taken it so we get the community immunity. And the best guess is that's sometime next summer. No one knows exactly, but that's the best guess of the experts. And that day will come. But today I want to talk and examine exactly where we are as of today in regard to this virus, what the essential facts are. Then I would like to briefly talk about what I believe that we have learned in the last 7.5 months. So today, October 15th, these are the essential facts. Yesterday, we reported 2,039 cases, our record. Today, we're reporting 2,178 cases, another record. This is in stark contrast to not too long ago. September 20th, barely a month ago, we had 762 cases. And for some time, we were hovering around 1,000 cases. So we've gone up dramatically in a relatively short period of time. Number two, in addition to the increased cases, we're seeing more people get sick enough to be hospitalized. Hospitalization, of course, is a lagging indicator. And as we see more cases, we assume we're going to see more hospitalizations. But already, we're seeing a significant change. On September 20th, we had 563 COVID patients in Ohio hospitals. Yesterday, we had 1,042 patients, COVID patients in Ohio hospitals. So it's basically doubled in a short period of time. Number three, today, we add 13 new red counties, giving us a total of 29 red counties. That represents 65% of the population of the state of Ohio. 65% of us, basically 2/3 of us, are now living in red counties. Number four, in addition to our 29 red counties, we also now have 52 counties that are high incidence counties as of today. And again, want to define what that means. This means the county has more than 100 cases per 100,000 residents during the past 2 weeks. This number is the distinction that the CDC makes between a county with a moderately high level of spread and a high level of spread. So 52 counties, high level of spread. We certainly know that a high level of cases in the community means a higher risk of catching the disease for everyone. Number five, before we get to that, let's go directly, Eric, to the numbers, and we'll start with the summary. Again, as we said, 2,178 cases. Our 21-day average is still there, but it certainly is moving up as these numbers continue to go up. Reported deaths today, 5. Hospitalizations, 108, a little bit over the 21-day average. ICU admissions jumped rather dramatically with 43. Let's look at the next slide, Eric. This is our advisory last week. This is what the state looks like this week. Let's go to the next slide, Eric. So this is what we're looking at today. And again, the H simply means high incidence. So we're seeing a good part of the state in red. We're seeing very little of the state now. 7 counties that are in yellow. Let's take a look at the next slide here. And this is just putting the high incidence counties together with the red counties. Those are the ones that have color to them. And again, it shows that most of us live in a high incident county or a red county. Let's take a look at the next one, Eric. This shows the change. And we've taken each week going back to July 2nd. and shown how many counties were in the yellow, what percentage were in the orange, what percentage in red. And so if you flip over to here, you see yellow is very, very small. We've got some of the orange, and then red is the biggest, pretty much that we have seen it. It was fairly high back on, looks like July 16th. It was fairly high there as well. Let's take a look at the next slide, Eric. This is all 88 counties ranked by the highest occurrence. Again, we're seeing a number of counties, well over half the counties that are high incidence. So if you take down, you go down, the first 52 counties are above that 100 or above. And if you look down below that, you'll see, if you look at the next 10 counties, they're creeping up on those numbers too. Let's go to the next one, Eric. This is again from the top to the bottom. Not all 88 counties. We've got, I think, 20 counties here. And you can see these are all, at least 2, sometimes 3 times as much of the high incidence. I want to talk briefly about why the high incident number is important in conjunction with our public health alert system. The two figures, the alert system, the color code, color maps, as well as the list of high incidence counties really work together. It's like looking at the weather report for the day. You can't make your decisions by looking at only the temperature or the chance of rain. Everything all kind of works together. When looking at the spread of COVID, one of the most important factors is how many cases there are in a population. And you'll look at that for the last 2 weeks. So it's not historical, not something happened three months ago. It's what's happened in the last 2 weeks. And so we can think of this like the temperature for the day. It's your most important number for knowing what you need to wear if you're going outside. So it tells you, how much spread you have in your county. Again, likening it to weather, the temperature tells you a lot about the weather in a day, but it doesn't tell you if it'll be windy, rainy, snowy, humid in the future. So we should think of the advisory system, that map system, as the rest of these factors all put together. And some of them, frankly, are early warning signs. The advisory system, your county's particular color, combines several other measures like the number of people going to their doctors for COVID or the number of patients in your hospitals with COVID. Cases per capita are incredibly important for understanding how much spread and potential spread there is in the community. And the advisory system is another layer of information. It's like looking at the temperature and then also getting an alert for strong winds in the area. But here's the difference. The difference is we can't generally change the weather. We can't change the weather, but we can change the outcome. And so these are reflection of what we see today, but also a reflection of early warning signs. But we can change the ultimate outcome down the road by what we do today. Let me also talk about a couple other numbers. Our positivity number today is 5.4, and our 7-day moving average is 4.2. During the third week in September, our positivity number was 2.7. This simply means that the percentage of our tests coming back positive has more than doubled. This is very important. As we see tests go up, we would expect to see some more cases. But what we really then have to look at is positivity. And what we should be seeing is a decrease in positivity as the testing goes dramatically up. Instead of that, we're seeing not a decrease in positivity, we're seeing a very, very significant increase. So in summary, at this point, we have 70 counties. 70 of our 80 counties that are either red or high incidence. That's 10 million Ohioans, or 85% of the population, live in an area with a high risk of community transmission. I want to review, because we've not done this for some time and because so many Ohioans are now living in a red county, I want to go through and look at the indicators. Indicator 1 is called new cases per capita. The indicator is flagged if there are greater than 50 cases per 100,000 residents over the last 2 weeks. This allows for counties with different population sizes to be appropriately compared. This is what we've been saying. It is our temperature and the weather report. It's very important, but it's not the whole picture. Indicator 2 is sustained increase in new cases. This is an indicator. This is an early warning sign. This is flagged if there is an increasing trend for at least 5 consecutive straight days in overall cases by onset date over the last 3 weeks. This reflects disease spread in the population. Indicator 3 is proportion of cases not in congregate setting. Again, what this is trying to simply determine is if more than half your cases are not in congregate setting, that tells us there is spread clearly out in the community. Indicator 4 is sustained increase in emergency department ED visits for COVID-like illness. This is flagged if there is an increasing trend of at least 5 consecutive days in either the number of visits to the emergency department with COVID-like illness or a diagnosis over the last, and this is all over the last 3 weeks. It provides information on the healthcare seeking behavior of the population and a sense of how concerned residents are about their current health status and the virus. Indicator 5, sustained increase in outpatient visits for COVID-like illness. This is flagged where there is an increasing trend of at least 5 consecutive days in the number of people going to a healthcare provider with COVID symptoms who then receive a COVID-confirmed diagnosis or a suspected diagnosis, and again over the last 3 weeks. So this indicator requires some kind of diagnosis from a doctor rather than just a patient reporting COVID-like symptoms. In addition to providing information on how concerned residents are about COVID, it also gives us an early indicator of healthcare use for COVID. Indicator 6 is sustained increase in new COVID hospital admissions. This is flagged when there is an increasing trend of at least 5 consecutive days in the number of new hospitalizations due to COVID, and this again is over the last 3 weeks. This informs us of the burden on the hospital system and disease severity, and is a sign that the storm clouds are gathering. In fact, that it's coming. We could be in for a very, very heavy storm. As you recall, this indicator has to do with because people end up many times in regional hospitals. That is indicated. Indicator 6, intensive care unit bed occupancy. It's flagged if both the percentage of the occupied ICU beds in each region goes above 80% for at least 3 days in the last week, and more than 20% of ICU beds are being used for COVID-19 positive patients for at least 3 days in the last week. There are 4 of these indicators that are typically present for our red counties so far. This is what our weather forecast looks like. 2 indicators are present in all of these 29 counties. Indicator 1, which is new cases per capita, and indicator 3, proportion of cases not in a congregate setting. Indicator 2, sustained increase in new cases, is flagged in 22 of our 29 counties. And indicator 5, sustained increase in outpatient visits, is present in 23 of the 29 counties. Both of these mean we're seeing the weather start to turn in these counties. As again, an early indicator. Indicator 4, sustained increase in emergency visits, is flagged by 10 red counties. And indicator 6, sustained increase in hospital admissions, is flagged by just 3 of the red counties. Again, unlike the weather, we have the ability to control this, but this is where we are today. We have, as I said, 13 new red counties today, new red counties. I want to talk a little bit about what we are seeing in the data and what we're hearing from the health commissioners in regard to those counties. Almost to a person, our local health department officials have told us this week that our schools are doing a very good job. But what they are seeing is spread, sometimes connected with the schools, in social gatherings, but not officially connected with the students. Could be social gatherings among students, among parents or others. Examples include bonfires, birthday parties, weddings, funerals. We know that several red counties still have several formal events planned, like pub crawls, political events, art fairs, car shows. Now is really the time to rethink whether these are in the best interest of the community. Our health commissioners tell us they're seeing less and less mask compliance when people are out, and that people are not wearing masks when they're with friends and family. As one health commissioner said, people are complacent in places where they're comfortable, and that's human nature. And we've talked about this before, but what we're seeing many times is people who are with friends, with family, letting their guard down, not wearing a mask, not keeping the social distance. If you're in a red county, if you're in a county with high incidence, the virus is spreading throughout your county quickly, and everyone is at risk really of catching it. Let's look at some examples. In Cuyahoga County, they have seen a significant increase in daily outpatient visits. In just 10 days, outpatient visits, they were averaging 187 cases per day. Outpatient visits, now 445. So from 187 to 445 within a period of 10 days. Down in Lawrence County, a southern tip of Ohio, a high school was closed for 2 weeks after a non-school associated homecoming event led to at least 7 children getting sick and 25% of the school being quarantined. The cases are now expanding, unfortunately, to other family members. Fayette County, a school and a daycare were closed after staff went to work sick. Our friends in Fayette County have had 2 members of their community die tragically during the past 8 days. In Mahoning County, an elderly woman died after attending a relative's wedding. There were 10 cases associated with the wedding. Muskingum County, they're still seeing 1 or 2 new cases each week from their outbreak at their social clubs, and this started around September 18th. And so these are just examples of some of the stories that we are seeing, some of the things that we're continue to learn. The message, is the same. Stay home when you're sick. Keep your distance. Wear a mask. Wash your hands.